for Garford, Eagle, and Pickens counties is basically find a way to collaborate with all other folks, agencies, providers, individuals, clinicians who are attempting to do the same thing we are, who see the need for community-based care. We'd like to get everyone together on the same page. So it's not just us. Alice and Heather would change the world, if we could alone. But, we've been trying to do that now for a few decades and with some success, I'd say. Just kidding. It takes a village. And we all know, hence why we're here, hence the WHA, Valley Health Alliance, why we're all here today. So this was the brainchild of not just us, but a group of other folks who are either actively providing or trying to provide home health services in our valleys. We recognize there's so many barriers and hurdles for agencies to succeed here, which we've already talked about, let alone for a startup that isn't backed by a larger corporation. So we've got individual clinicians, home caregivers, therapists, private nurses, for example. There are so many prohibitive barriers that we have to billing, compensation, sustainability. We've got to find a way to share resources. So far, we're very small. We have a handful of founders. We've got a board of directors formed. We do have our nonprofit status, and soon, actually starting today, we're going to be opening our membership to anyone and everyone that wants to join. So this can be established agencies, which we know there are only a few. We've already connected with some of them, new agencies, and then individuals, other care systems, hospitals, clinics, many of who are represented here today. But our goal is to host monthly educational meetings, join forces with staffing and recruitment, and ultimately, hopefully pursue joint fundraising. Our mission statement is we are committed to enhancing access and a care system that has historically been underserved in rural areas. We aim to support a resilient, sustainable home-based care ecosystem by strengthening new agencies, encouraging responsible growth, and building together so that home health and hospice services in our region remain stable and readily available for community members to age safely in place in our mountain communities. So it's a lofty goal, it's a lofty mission, but we know we can do it. Moving on, I do want to share, we are hoping through the RCA to essentially access some of those RHTP funding opportunities. We're not naive to the idea that this is, it's the elephant in the room, right? It's those big 5 pillars. We know that Colorado has just received a lot of funding, and that very soon that funding will be making its way to our local health systems. Whomever the recipients of those dollars are, we don't know yet. We don't really care. As a group, we just want to be here and hopefully find a way to collaborate with those recipients to ensure that CDPHE's mission for those dollars is realized locally. And it all boils down to us bringing as much of that funding into our communities that we can. The 5 pillars, if you're not familiar with RHTP funding, right now, our first round of funding, Colorado just received $200 million. The 5 pillars are regional collaboration, innovative care models, workforce development, chronic disease management, and technology and infrastructure. Sound familiar, right? That's what we're here to talk about today. So I can't emphasize enough. We're not here to present some kind of profit-making solution that will benefit, a home office somewhere else. We're here to rally the troops and hopefully gain your support, and if anything, your ear and your voice. So join us today. We are open and available to accept referrals. We have some information in the back for Home Key. Just so you know, we are providing home health, skilled and non-skilled care. We are live. Our Medicare and private pay applications are in process. We do have a very manageable sliding scale fee for private care now. As we speak, this includes a very low cost option for those who are even uninsured or low income. So we recognize, again, one of the barriers, getting registered, getting to where we can receive insurance dollars is hard, but we're doing it. We're doing it from the ground up. But most importantly, we want you to spread the word. Take this back to your agencies, your partners, and we'd like for you to join us. So we do have a sign-up sheet in the back of the room for the Resilient Care Alliance. We're building this safety net. We are just getting started, so we'd love to hear from you. Anyone in this area who is in any way serving patients in their homes or needs a way to be able to share resources into the patient's home, because that can really be anybody. We'd like for you to leave your email with us so we can send you information about what's happening with the RCA. Feel free to email us with information. Next week, I'll be sending out an invite list with some of our first events that we're hoping to plan. We do have some events already planned and coming up. We've got 3, one in each county through the months of May and July. We're co-hosting these as Home Key Health and also with the RCA. We focused on workforce development and staffing. So if you're interested, please send us your information. And of course, share it with any other caregivers in the Valley that are either looking for work or looking for support. So without further ado, I'd like to move on to just a fun activity we're going to do. It's called the Village Scalability Test, just for fun. Before I do that, though, any questions about what I've presented, who we are, what we're trying to do? I know this is rapid fire, but I'd love to take questions.